Thank you. Thank you. Thank you so much, Carrie. It's incredible to be here at the ACLU Luncheon, standing together for justice. I cannot go forward without thanking the ACLU, particularly Carrie, for having the foresight to hire Kurt and to put Kurt on the Flint beat. And I cannot say enough about Kurt. So it was his stubbornness as an investigative reporter. He dug and he dug and he dug when nobody was digging. And he was not only the journalist, but he was a protagonist in the story. If it was not for him, the dominoes would not have fallen afterwards. Without his work, we would most likely still be drinking that water in Flint. I'm not done talking about Kurt. So he gets about as uncomfortable as I get when people talk about him. So if anybody has had the pleasure of reading over all the FOIA emails that the state has released, you truly understand Kurt's essential and pivotal role in blowing this whole story open. I cannot say enough how grateful we are for the ACLU of Michigan for showing that incredible foresight and bringing him on as an investigative reporter. In a time when investigative journalism is declining, we have less and less investigative journalists, and that's who we need more and more of. And he was rightly there to expose our democratic failings, partly due to the emergency manager law. So Kurt and now the many other journalists who covered this crisis gave the world the language to describe the horror that the Flint citizens were going through, their drinking water, when they knew it was dirty, but they were told it was safe, and they were essentially lied to for 18 months by every agency that was supposed to protect them. And I don't know if you guys have all heard, but Kurt also just recently received the 2016 Hillman Journalism Prize Award. So this is a huge, huge deal in journalism. So amazing, amazing, amazing. He's gonna kill me. So I cannot thank Kurt enough for what he did and for ACLU's insight in bringing him on. So on to Flint. So this all started in April of 2014 is when the water switch happened. So now we are in our third year. We are in our third year of water that we cannot drink. And Michigan, we have the hand, and we know where Flint is. We are literally in the middle of the Great Lakes, in the middle of the largest source of fresh water in the world. And we have a clearly demarcated population of poor people who do not have access for the third year to safe drinking water. And it's unfathomable. And as Carrie told us, we know how the lead got in there. In 2011, we started a series of emergency managers. We had 4 of them with the focus of save money, save money, save money, save money. They severed a half-a-century relationship with Detroit. We were getting pre-treated Great Lakes water for 50 years. And they severed that to draw water from the Flint River. And the Flint River water was innately more corrosive than the Great Lakes water, but what was criminal was the neglect to add corrosion control. It's like a medicine that you put in the water to prevent lead and all these metals from leaching out of the pipes and into the drinking water. And if you talk to any water expert, it's a no-brainer. It's a no-brainer in the water engineering world. Every single water treatment has a corrosion control plan, and we did not. So for 18 months, like Carrie said, our residents were literally told to relax, even though when water looked gross and when it tasted gross, and when they would take, for real, brown jugs of water to town hall meetings, and residents would get arrested. They would get arrested because when you have lost democracy, who listens to people's complaints? And the heroic people of Flint were standing up and they were raising their voices, and those all had fallen on deaf ears. So no one in government, every single agency that was supposed to protect these children failed. They failed to listen to the courageous and the heroic people of Flint. And something that the ACLU activists understand is that the First Amendment has no meaning when your government is taken away from you, and that's what was happening in Flint. And like Carrie also mentioned, there were so many truth tellers besides the incredible moms and the activists and the pastors. Leanne Walters is a pivotal role. She was a mama that you didn't want to mess with, and she was the first domino in the story. Miguel del Toro, an incredibly brave whistleblower at the EPA who was silenced and had the foresight to share his memo with Leanne that got it to Kurt. And then Mark Edwards, so a Virginia Tech engineer. And when I first heard that there was a Virginia Tech engineer coming to Flint, I'm like, what the heck is somebody from Blacksburg, Virginia, coming to Flint for to test our water? And an engineer, no less. Throughout this last 9 months, he's almost become like my brother. And I don't think I would have met anybody outside of my field of pediatrics who cares as much for children as he does. When he heard what was going on in Flint from Leanne and others, he packed his minivan overnight with grad students and with supplies, and he drove up to Flint, hoping to use citizen science to prove that our water was contaminated, that the residents were right. And he did prove it, but unfortunately, his evidence also fell on deaf ears. So all of these truth tellers were dismissed, they were all ridiculed. And when I heard that there was a possibility of lead in the water, any pediatrician, we kind of freak out when we hear about lead. It's a call to action. It's not a 9-to-5 job when you mess with lead. We know what lead does. It twists behavior, it erodes cognition, it has a multi-generational epigenetic effect. Mothers exposed to lead, you can see the DNA changes in grandchildren, and it already infects our most vulnerable children. It's a form of environmental racism. Our kids in Detroit, our kids in Flint, our kids in Chicago, our kids in DC are disproportionately affected by lead. It alters a child's entire life course trajectory. And so when you hear about lead, you don't sit on it, you get to work. And that kind of started my crusade to see if that lead in the water was getting into the bodies of our children. And that's my job. That's my job as a pediatrician. My job is to make sure that the kids in front of me are healthy today for their checkups, but my job, more importantly, is to make sure that my kids have the brightest future possible. That's what we do in pediatrics. It's prevention, prevention, prevention. And what was happening in our water threatened the tomorrows of all of our children. And it was just my job to figure out what was going on. So when we did our research. We did our research in about 2 weeks, which was record time. It was really about 6 months of work. We just cut sleep out of the picture because we had to know what was going on. And then just like all medical research, we released our research at a press conference. No. That's not how you release medical research. And that was the first time that I met Kurt, because I had seen him in all these videos that he had done. And I remember going up and shaking his hand and thanking him for his work. So we released our research at a press conference because we could not wait. We had an ethical, a moral, a professional obligation to share this with our community as quickly as possible so that things could change. And I felt great after our press conference. I'm like, yay, things are gonna change. And that lasted about 2 hours because shortly thereafter, I was attacked as well. Just like the moms and the pastors and the activists and the journalists and the scientists were attacked, I was attacked. I was called great names, an unfortunate researcher, causing near hysteria, splicing and dicing. It's all fantastic. But fortunately, with the help of the media, that created a tsunami after this research was released, and all the other voices that were previously silenced were finally heard. The next day, the city released a health advisory. Shortly thereafter, we were in a public health emergency, and then a few weeks after that, we finally switched back to Detroit water. But it should not have taken evidence that children were being poisoned. Any of those other voices should have been heard, and if democracy was in place, those voices would have been heard. So I want to share a little bit of near hysteria. So the World Health Organization's action level for lead in water is 10 parts per billion, 10. That's when you need to do something about it. The Environmental Protection Agency's action level is 15 parts per billion. Both arguably too high when now we know that there's no safe level of lead in a child. And just a month ago, in April of 2016, a home in Flint had a lead level of 22,905 parts per billion. In April of 2016, 6 months after being on treated water, we have a home with a lead level of 22,905 905 parts per billion. You can't even really wrap your head around it. You know, you can think of it as if we're drinking through these lead-painted straws, and you never know when a piece of that corroded lead pipe is going to come off that straw into our drinking water and into the bodies of our children. And for 3 years now, we've been drinking through these lead-painted straws. So we actively are working on flipping the story. Flint is not going to be known as this disaster. This is not what's going to be to define us, because you all know that Flint has an incredible history. You know that Flint is what built our state and our country into this powerhouse. General Motors was born in Flint. The historic sit-down strikes that birthed the unions, that created the middle class, that was Flint. That created the American dream. So it was those cars built with the sweat and tears of Flint workers that really put America on wheels. We used to have, in the 1960s, we had the highest per capita income. We had the best public health indices in Flint. People came to Flint from all over the world, really, for good jobs, really great jobs, and great infrastructure, and great schools. But we all know that that story changed, and now we lead the nation on bad stats, on violence and unemployment and drugs and obesity. Every disparity you think of, we have. We're ranked, Genesee County is ranked 81 out of 82 in health outcomes in our Robert Wood Johnson health rankings. But these are all symptoms of deep poverty. But Flint is not going to be defined by this crisis. Today, we are building a model public health program. We are working in a place that is defining how a city heals itself, protects itself. We're kind of a ground zero for what we can do. And it's a place for new ways of thinking, born from the need to soar out of the downward spiral of our past. And very much we are hoping Flint becomes a place of hope, because we owe it to these children. They did absolutely nothing wrong besides live in a poor city that was almost bankrupt, that lost democracy, that didn't treat its water properly. We owe it to these children. So we are advocating for and we are implementing every intervention that we can think of to promote these children's development. Interventions like early literacy programs and universal preschool and school health services and nutrition access. We have no grocery stores in Flint. Healthcare access, behavioral health access. These kids need everything. All vulnerable children need these things, but our kids in Flint need them now. They needed them 2 years ago. They needed them decades ago. So as we look ahead, we are creating this public health center that we hope to be a guiding light for those finding themselves in many other communities in the darkness of poverty and surrounded very much by the deafness that goes along with it. But we have a lot of work ahead of us because, like Carrie said, there's Flints everywhere. There are injustices everywhere. Many people are like, what can I do? How can I come help Flint? I want to get on a bus and come to Flint and help. I'm like, you don't have to come to Flint. Detroit, you know, anywhere you are, every community that you are in, there are injustices and there's people that need to stand up and use their voices to work in these communities. So already, the story of Flint is changing the conversation. We've had national repercussions because of what we were doing and what we did and what we continue to do. People are talking about lead. We thought lead was a problem of yesterday. It's a problem of yesterday. It's a problem of today. It's very much a problem of tomorrow. People are talking about water quality. They're talking about democracy. They're talking about austerity. They're talking about environmental injustice. They're talking about indifferent bureaucracies and about rotten infrastructure. This has become a national story about forgotten places in this country and largely about forgotten people. So like I said, and like I continue to say, I was just doing my job, and this is my job as a pediatrician, and I'm continuing to do my job to fight for our kids because we need to garner the long-term resources so that we can flip the story, so that our children not only recover, but they thrive. Because in 10, 20 years, when we're going to share with you what we were able to do, and it's not going to be the consequences of lead poisoning. It's going to be the consequences of what we were able to do when we all came together and invested in our most vulnerable children. But I think my job is also to tell the story and to tell it all the time and to retell it so that it doesn't happen again, because we can't let another Flint happen. So thank you again for this opportunity, and I want to thank you especially on behalf of our kids in Flint. Our kids are smart, and they are strong, and they are resilient, and they are beautiful, and they are very much the true heroes and the survivors of this crisis. So I stand here together with you for justice. Thank you for standing with me. Thank you for standing with Flint, and thank you for making this your job too. Thank you. Thank you. Thank you.